Hi, and welcome to this Friday's 5-minute consult with your favorite family medicine doc. In these videos, I discuss everything that you need to know about some of the most common health conditions listed from A to Z. And this week, we are about halfway through the alphabet, as today's topic starts with the letter N. So let's talk about nosebleeds. What are they? Nosebleeds occur anytime you have bleeding from your nose. This can be mild or severe. Episodes of bleeding from the nose occur most commonly in children ages 2 to 10 years old, but it can also occur in adults ages 50 to 80 years old. There are actually two types of nosebleeds, and this includes anterior nosebleeds, which is bleeding from the septum area of your nose. This area has a lot of small blood vessels, and they can sometimes easily break and lead to bleeding. The second type of nosebleeds includes the posterior nosebleed, and this typically occurs more commonly in elderly patients who have high blood pressure. With this type of nosebleed, the bleeding typically starts further back in the nose. Posterior nosebleeds in older adults tend to be more serious, but both types of nosebleeds can lead to blood flowing to the back of the throat. What is the cause? The majority of nosebleeds are actually spontaneous, meaning they don't have a specific cause and they happen on their own. However, if you get nosebleeds a lot, it may be due to one of the following causes, which include living in or spending time in a drier climate with heated air that tends to dry out your nose, picking your nose, rubbing it too hard, or an injury to your nose with a foreign object. If you have a cold or the flu, a bloody nose can be due to blowing your nose repeatedly. Using nasal sprays or taking antihistamines for allergies can also dry out your nose and lead to nosebleeds. Taking aspirin on a daily basis or other blood thinners. Having a deviated septum, being exposed to chemical irritants, as well as pregnancy or alcohol use. In rare cases, certain blood disorders can lead to more frequent nosebleeds, as well as a rare sinus tumor. What is the treatment? In most cases, nosebleeds are not very severe and they can typically be treated at home. If you experience bleeding out of your nose that is more than just that on a tissue or your finger, then what you want to do is first stay calm, because panicking can actually make the nosebleed a bit worse. The second thing that you want to do is make sure that you continue to sit up and not lie down so that any blood does not drain into the back of your throat. You will want to use your thumb and index finger to pinch your nostrils, and you want to hold it there for about 5 to 10 minutes or until the bleeding stops. This allows you to apply gentle pressure to the area of the nose where the blood vessels may be leaking. Once the bleeding stops, you don't want to touch or blow your nose, because this can cause the bleeding to start back up again. But if the bleeding does start back up again, you can gently blow your nose to remove any blood clots. Other treatment options that can be used at home to help with bleeding of the nose is a certain nasal spray, and one of those is called Afrin. This is a medication that helps constrict the blood vessels within the nose and help them stop bleeding as well. When should you see a doctor? You will want to see your doctor if the bleeding does not stop after 20 minutes of applying pressure. Other reasons to see your doctor for a nosebleed would include if you don't get nosebleeds very often and it is severe, if the nosebleed is severe and you are on a stronger blood thinner such as warfarin, or if you fell and hit your nose leading to trauma of your nose, which could include a possible broken nose. Treatment options in the clinic or the ER may include cauterization. This is a procedure that gently burns the blood vessels within the nose to help stop the bleeding. There are two types of cauterization. One is using a small electrical heater to help burn the blood vessels. They will use a numbing agent before they do this. And the second one is a small chemical swab that is called silver nitrate, which also helps burn the blood vessels. Another form of treatment for severe nosebleeds includes packing. This is where they will place a small latex balloon or a rolled up piece of gauze into your nose to help apply pressure and also stop the bleeding. Sometimes this packing will need to be left in for a few hours, and if it is really severe, it may have to be left in for a few days, but it should stop the bleeding, and you will want to follow up with your doctor if you have any other issues. Now let's talk about prevention. So the first way to prevent nosebleeds is to keep your nose moist, because dryness is one of the most common cause of bleeding in the nose. And a way you can do this is by using a small Q-tip or cotton swab and apply a small amount of petroleum jelly. You want to gently apply it inside your nose to both nostrils 3 times a day and before you go to sleep. If you can't do it up to 3 times a day, at least applying a small amount before bedtime should help keep your nose moist for the morning. You can apply more or less depending on the severity of the dryness of your nose or how often you are in a heated, dry environment. Another option to keep your nostrils moist include using a spray with saline. Also, if you live in an area where the air is more dry, you may benefit from purchasing a humidifier to put in your house. You want to remember not to pick or rub your nose too hard, and for children, you can help them out by keeping their fingernails cut short so that they don't accidentally scratch their nose. And lastly, when it comes to medications, if you are on a blood thinner, you want to be extra cautious about not hitting your nose. And as for some allergy or cold medications, you don't want to overuse nasal sprays, as these can also lead to an excessive drying of the nose and nosebleeds. And that wraps up our discussion on nosebleeds. I hope that this information was practical and informative for you to help treat nosebleeds. If you have any further questions, please let me know in the comments section. I would be happy to answer those for you. If you would like to see more educational videos like these, be sure to subscribe, and I will see you on the next video. Until next time, bye!